What is injury risk assessment for athletes? Have you ever wondered how athletes stay in peak condition and avoid injuries? Injury risk assessment plays a vital role in this process. It is a systematic method used to identify and evaluate factors that may increase the chances of an athlete getting hurt. This assessment looks at both modifiable and non-modifiable risk factors by examining an athlete's medical history, physical condition, movement patterns, and training habits. The journey begins with screening. This involves gathering information through questionnaires about past injuries, current health, and training routines. After screening, the evaluation phase takes place. Here, physical assessments are conducted to measure strength, flexibility, and movement. Sometimes, video or biomechanical tools are used to spot any abnormal patterns or weaknesses that could lead to injury. Once the data is collected, profiling is done. This means compiling the findings into an individualized risk profile. This profile highlights areas where the athlete may be vulnerable and helps create targeted intervention plans. Key elements of injury risk assessment include reviewing medical and injury history to understand past issues that might affect current risk. Physical tests measure strength, flexibility, balance, and coordination. Movement analysis is also essential. It helps detect inefficient biomechanics, like improper joint alignment or muscle imbalances. Monitoring training load and fatigue levels is crucial too. Sudden increases in training intensity or volume can raise the risk of injury. It is also important to consider non-modifiable factors such as age and previous injuries, alongside modifiable factors like muscle strength and technique. Emerging technologies, including artificial intelligence and machine learning, are being used to analyze complex data from these assessments. This improves the accuracy of injury predictions and allows for more personalized prevention strategies. In the context of training for athletes, injury risk assessment is essential for designing training programs that balance workload and recovery. It helps correct movement dysfunctions and address specific vulnerabilities. This proactive approach keeps athletes healthy, maintains performance levels, and extends their competitive careers by reducing injury-related downtime. Trainers and coaches utilize injury risk assessment results in practical ways. They customize strength and conditioning exercises, targeting weak or imbalanced muscles. They also adjust training intensity and volume to avoid sudden spikes that increase injury risk. Movement retraining is implemented to improve technique and reduce joint stress. Rest and recovery periods are scheduled appropriately, and ongoing risk factors are monitored throughout the season to adapt training plans as needed. Overall, injury risk assessment is a foundational tool in athlete training. It integrates medical, biomechanical, and performance data to minimize injury risk and support sustained athletic development.